Hello, everyone. My name is Linda Yaboti. I'm going to be discussing pain management and palliative care. Pain management and palliative care, we're going to look at how they're different from other disciplines. So, pain management and palliative care, they kind of go hand in hand. They're very crucial and essential to each other. Pain management is a part of palliative care. Pain management involves the physical and emotional self at a very basic level. The goal of palliative care is to prevent and relieve suffering and to support the best possible life for patients and their families. Uh, Regardless of the illness or the other treatment or therapies they're receiving, pain and symptom management are essential component of palliative care. Um, this is important because people that are struggling with severe or acute illnesses struggle with a lot of pain, and this can impact the way they live their life, the way they interact with their family. This can affect the way the family experiences a person while they're struggling, and can also affect the way the person interacts with their family. In palliative care setting, the experience and pain management of pain impacts by multiple challenges presented by diseases such as cancer, multiple sclerosis, AIDS, and etc. Um, there are a lot of other diseases out there that are considered part of or do receive palliative care services. Um, no matter what the symptom, pain seems to be the presenting problem when people show up in healthcare setting like the hospital, the ER. They struggle with pain. They struggle how to manage, how to live. Although they have terminal illnesses, but with proper pain management, they are able to have some quality to their life and spend some time with their loved ones and be able to participate and function. The pain limits the way they function daily. So, pain management and palliative care provide a very, very essential service that people that struggle with illnesses really need. The challenges here when we're looking at pain management and palliative care and the need for the service is that some patients or some people, and they don't have to be in the hospital, people do get services at home also, struggle and they could be getting relief from palliative care or proper pain management, but because they do not understand the services that these services provide, they do not take advantage or full advantage of it. Um, and that, affects the way they live their life every day. Because some people do think that palliative care has a lot to do with hospice, and when they hear palliative care, they think it's the same thing as hospice, and they don't want to talk to a palliative care or anybody that is affiliated with a palliative care service. They don't want to hear anything they have to say or any other options. I had the same experience because my first internship, I spent a couple of weeks at palliative care at the hospital that I work in. And I was really surprised because I was one of those people that thought palliative care was the same as hospice. I've always assumed that. But I was amazed to see the work that the palliative care interdisciplinary team does. This team comprised of a social worker, you have a medical doctor, you have different specialties, oncology, neurologist, pain management, uh, pharmacists, just different disciplines that come together and make up the interdisciplinary team. And the social worker, what she does is just have a conversation about life and, what the person expectations are, how they want to live their life, if there are any plans they've made, looking at quality versus quantity of life, looking at comfort care, just exploring all options and making sure that the person have informed information for them to be able to make a decision that will be helpful to them. So I found that to be very, very insightful, and my perspective on the field actually did change. Um, so those and the other challenge out there is there's not a lot of social workers that are trained in this field, which is needed, desperately needed. With the palliative care team that I worked with for a couple of weeks, they had one social worker, and when she was off, there was nobody else to replace her, so the team just went on without her. And I had this discussion with her. It's just not a lot of social workers that maybe they're not aware or of the service and what they provide. They don't understand what the service entails, and also they're not properly trained. So that could present a problem. When we're looking at addressing the services, pull up a couple of articles. One of the articles that I read, and stated that palliative care provision is a multidisciplinary and multi-agency, which is so true, because in working with the palliative care team, you see that they have to employ a lot of services of different agencies, and different services from within the hospital. And if the person's going home or to a long-term care facility, they have to be aware and know who's out there, what's out there, and have those services set up before the patient leaves. So it's being very knowledgeable, being cultural, competent, and sensitive, understanding how the other services work and what you need to be able to set them up is very, very important. Addressing the challenges and needs as we go on, we see, or I see, I was able to find an article that discussed this 2 days training. It's promoting excellent in pain management palliative care. It was very fascinating reading about this training and what it entails. And the goal of the program is to improve social work skills in pain management and palliative care, and to promote collaboration and team functioning, which is very necessary for medical social worker, and also a palliative care social worker. As we continue to look at the challenges and the needs, the course offers, the course was designed to encourage exploration of the social work role regarding pain management and palliative care across the continuum of care. The course is specific to palliative care and pain management, and just looking at every aspect of it and how a social worker can truly understand what their role is and what is expected, and how to support and advocate for their patient. This is, it says, some key course topics: the critical role of pain management and palliative care, building fundamental skills for quality pain and pain symptom management, pain and palliative care assessment, psychosocial spiritual intervention in pain in palliative care. Some objective of the course are to understand the critical role of a social worker in pain management. As I already discussed, that's very important. A social worker being knowledgeable, knowing the services out there, knowing what is available, looking at the patient from a person-centered perspective, understanding as far as resources, what the person can afford, what is available for the patient, what kind of insurance do they have, where do they live, what are the services in the community, linking the person to all four domains: their physical, social, psychological, spiritual, and just looking at that quality at the end of their, of their life, or even if it's not the end of their life, looking at quality versus quantity, and trying to make sure that the patient needs are met while you're working with the patient, and also having them be part of the conversation is very important. A lot of resources out there for patients. There's some website that I came across that provide a patient with a good picture of what palliative care and pain management looks like. There are a couple of videos for them to watch. There are educational information in there. It's good that the palliative care worker can educate the patient and their family into what is going on, prognosis, diagnosis, services, resources, but it's also good that the family and the patient are able to kind of look up these information themselves and just be very well informed in order to make informed decision. Resources for social worker, I came across the National Consensus Project on Palliative Care, which was established to formulate clinical guidelines to uh, clinical practice guidelines to promote consistent and high quality care. What I like about this, as I read through it, is that you can apply it to both a generalist and a specialist level. So if you're a medical social worker and you work within a hospital, it provides the guideline. It doesn't have to be an acute or chronic patient in order for you to apply their guideline. You can apply it regardless of what the person's going through, and you'll be able to support them and educate them through the process. Some of the highlights that I took away from Gerhardt and Brown is the principle and values underlying palliative care and pain treatment have much in common with what do they have in common with social work? There's a lot they have in common with social work. The approach is unique. The patient care is unique. There's a good quality in assessment that is individualized to the patient and their family. It is multi-dimensional and includes biological, social, emotional, spiritual, and environmental factors. It's looking at the person through meso, meso, micro, through the various system, and just really trying to make sure that they get the services, the resources, and that, they're able to, if they cannot afford that, you can look up the resources that will be able to provide those services to the person regardless of payment. And, the biopsychosocial is something that grows along with the patient. So it's not one and done. You can continue to do it. And as the patient needs change and to progress through their illness, the biopsychosocial assessment can also change along with them as you update it. These are my references. The course I was talking about, there's the website. You can read about it. If you're interested, you can try to, sign up for it, be a part of it. I thought it was very educational. It provided a lot of insight into pain management and palliative care. One thing I wanted to say before I close is that I feel like this course should be offered to all social workers that come through the MSW program instead of just being an elective. It has helped me grow personally and professionally and given me insight and understanding into social work from different perspectives. So a medical social worker works in a hospital, but the knowledge that a medical social worker gets can be apply everywhere, outpatient, anywhere you go. You just have more vast knowledge and you're aware of more than just what happens on an outpatient basis, and you're able to be supportive, helpful, and advocate as you're able to see the patient in the hospital, out of the hospital, wherever they go. But I think it was very valuable, and I do appreciate being given the opportunity to learn about medical social work. And I hope you learned something from my presentation. I look forward to your constructive feedback. Thanks.